Wonderful time, beautiful time of the year. It is sunny out here in Rugby and I feel at ease. I feel very rested. I've taken time out to rest my mind, body, and soul because I know today is going to be a beautiful day. As you know, my name is Adeline Sedekamga. I'm the founder and the CEO of FabAfriq Media Group and FabAfriq Magazine. Over the last few years, I have hosted numerous online forums. I've done webinars, I've done conferences, I've done seminars. But today I must say I feel privileged hosting this online session on behalf of All Mercy. This is purely because we might have different conversations at some point, but those conversations that are absolutely relevant are very important. It takes a visionary to put things like this together. And I want to say kudos to All Mercy Big for bringing this conversation up. We can never talk a lot or enough about mental health. Mental health is something that influences or that affects us time and time again. But sometimes we don't seem to understand what is actually wrong with us. There is a song that I really love, which says, sometimes I'm happy, sometimes I'm sad, and I don't know what is wrong with me. Our mental stability is being triggered by the list of things. The list of things will trigger us. But our ability to restabilize ourselves is truly important. Sometimes it can get really deep. Sometimes it can be superficial. But what is the most important thing is that if you, the person, understands exactly what is happening to you, you seek help and you take whatever prescription, medication, or action plan that has been provided to you seriously, you will be fine. From time to time, you might feel the low, and from time to time, you might feel the high. But then the gap between the low and the high is what is going to determine how low you're going to feel or how high you're going to feel. Which one comes often to you? Is it the low time or is it the high time? So this session has been brought to you, as I said, by All Mercy Inc. And I am just a facilitator. I have got the founder and the co-CEO of All Mercy, who is going to be telling us a little bit about All Mercy. If you are joining us, please do know that mental health is something that affects us. I would love you to share this within your network. Remember, the wider, the better. The more, the merrier. The more, the happier. So let's come together and see how we together can actually help to promote mental health awareness. Let's see how we can spot when someone in our community, someone in our network has an issue. Let's find out what resources we have out there to help them settle in, to help them re-stabilize. Mental health is real. The whole of this month of May has been Mental Health Awareness Month. We know last week was really the week that most practitioners and most activists intensified, the drive to raise awareness. I would say mental health awareness should be throughout. It should be every single day. We should raise awareness every single day. We shouldn't say it's only in May. So what happens in June? What happens in February? It doesn't choose when it's going to hit you. But when it hits you, it is good for you to be on guard. So I'm going to be introducing our host for this session, Dr. Mercy Gesang Kondos, for her to tell us a little bit about herself, why she decided to start All Mercy, why she decided to actually bring together a group of experts, a team of people to help raise awareness on mental health. So I'm going to see if Dr. Mercy is here with us. But before she comes, I just want to tell you about some of our speakers for today. Our speakers for today, we have Dr. Vivian Ngongang, who is going to be joining us at some point. She's a psychiatric and a relationship coach for women. She helps women heal after a relationship breakup and help them become ready for love again. Isn't that sweet? Her desire to help you heal, let go of unwanted emotions that have kept you stuck and help you to gain the clarity and peace of mind that you desire. I would say this isn't only directed to women, but I'll say to men as well. Although she's specialized, to women, I will want you, if you're out there listening to us, if you're a man, to know that you can always contact Dr. Vivian so that she can help you unlock what has kept you in the box. Our next speaker is going to be Amina Musa Wihilia. She's a CEO of Haybard Media, and she's a senior journalist who has a great journalism background. She's popular within the Somalis living around the world for her long and dedicated role in the media. Amina also doubles as a mental health advocate and coaches for better mental health. She has worked with the United Nations in different sectors and levels, and her work history is positively commended. I will say this and I'll tell you for free. I have read her background. Her accolades are so many. I can't even start listing them. But when I looked at some of the media houses that she has worked with, I keep asking myself, wow, one woman, so many umbrellas. Who do you want to name? You want to name BBC, CNN? Do you want to name her awards? Do you want to name, just name it. She's got so many awards. She's highly respected in her community. And I am so super happy that Dr. Mercy decided to bring her on board as one of our speakers. And next, I want to introduce our speaker, Dr. Ruchi Sharma, qualification in MPhil Clinical Psychology, MSc Psychology, University of Madras. Her field of experience cut across assessment for various psychological disorder, intellectual disability, ASD, ADHD, substance addiction, psychodiagnostic stress management, marital counseling, parenting counseling, pre and post operative psychological issues, psycho-oncology case, and a lot more. And I must add that reading about Dr. Sharma, I want to say her achievements is great, not only because she works with one of the largest hospitals and university hospitals in India. She has solved numerous problems, and the number of clients that she has under her back is what really qualify her to stand on our platform. When we talk about experts, we talk about how you work, we talk about who you work with, we talk about your achievement, we talk about the number of things that you've been able to achieve. And I can tell you that Dr. Richie, she is a go-getter, she is a thought leader, and she has earned the right to be on our platform. And then we have Reverend Georges Kinge. He has over 15 years of experience as a clergy, participates in leadership training in his home country, Cameroon and Europe. As an online mentor for strategies, he offers love, support, and hope, changing lives one conversations at a time. His intention to young people enable the creation of a youth association called African Youth Arising, which provides coaching and trains young people to acquire life skills. And I want to add about Reverend Georges. He's a Toastmaster. If you know what Toastmasters do, then you will agree with me that if you are a Toastmasters and you do the things that you do, then you're only designed for excellence. That said, I wouldn't want to describe or introduce Dr. Mercy. I'm just going to bring her straight on my stream and I'll let her tell us about herself. Hello, Dr. Mercy. You are on my screen. How are you?
Hi, good morning. Good morning.
Welcome to this wonderful webinar that you've put together. I want to welcome you as a facilitator, and I've just told the audience that you are the host for this. So that said, I want to give you the platform to tell us about All Mercy and to tell us about why you decided to put this program together. I'm going to put you on a solo.
Thank you so much. It's been having you coordinating all this, bringing all those wonderful speakers. Thank you so much. I appreciate all your efforts. It's good to talk about mental health, and I again want to welcome all our speakers for honoring my invitation, especially it being so short notice. Thank you so much for being here today with me. May, we always celebrate Mental Health Awareness Month in May. As you said, Adeline, why not every day? Yes, every day we should talk about mental health, but we recognize May as a symbolic month to celebrate mental health. I'm so excited today. We'll gain so much knowledge from the other speakers. Please, those who are watching online, do not hold your questions. We are here to answer them. We are so humbled serving the public today and talk more about mental health. What is mental health? We'll dive into that in depth again, but it is like every other illness out there, and it is as common as we can think. When I started the journey of finding all mercy, yes, I was looking for all mercy. I was looking for that tailored platform where people can come and have a safe spot where nobody will be judged and everyone will be treated as an individual, talking about their specific mental health issues. We looked a lot, we came out with so many different policies, and all this is just to put things in a place to serve you, to serve the public, to serve our community, to serve whosoever, anybody. That's how All Mercy came about. And in that process, we realize that it is a journey. Talking about mental health is not something we talk one day and end it the next day. It is a journey. Some days are better than others. Some days are fantastic. Then some days are just so low. We are ready to ride with you in that journey anytime. We have a world of speakers today from different places, and I am just so amazed with their backgrounds, with their knowledge, with their expertise, and what they are here to share as well. In All Mercy, we will be doing these webinars at least once every 3 months, so stay tuned. At All Mercy, you can come and find solace, you can come and find peace. You can come for someone to just listen to you. We do offer free consultation. We will listen and determine if you're a right fit for us. If you're not, trust me, we have the resources on where to refer you. We have psychotherapy, we have neuropsychology, and of course, we do have medication management. Everything you want, mental health wise, you can get it from All Mercy. And Adeline, thank you again for this opportunity. I am so, so happy that you were able to coordinate this. Thank you so much.
I am the one to thank you, to be honest. I think I'm the one to thank you.
You're wearing
That
green.
said,
I'm wearing green.
that said, it has been an honor to put all this together on your behalf, and I'm sure as the time goes on, we're going to be able to do a lot more. So I'm going to start by adding our first speaker on the stream, and she's Dr. Ruchi Sharma. So I'll get her to join us. Hello, Dr. Ruchi. How are you?
Hi,
Hi,
Adeline. Hi,
Eileen.
Dr.
Hi, Dr.
Mercy.
Mercy.
Hi,
Hi,
Dr.
Dr.
So
So
honored.
honored.
I hope you're doing well. How is the weather over
Yes,
there in India? Is everything good and sunny?
yes,
Yes,
it's
it's
brilliant.
brilliant.
Okay, perfect. I'm going to ask Amina as well on the stream with us. Hi, Amina. How are you? I'm just going to unmute your mic. If you can unmute your mic, that would be great. Can you unmute your mic for me, please? Okay,
sorry,
perfect.
Sorry, I forgot.
No problem at all.
Good
No
Good
afternoon,
problem.
afternoon, all of
you.
you.
I
I
am
am
honored
honored
to be
to
with
be
you
with you
this
this
afternoon
afternoon
with this
with this
great
great
program
program
on live
on live
stream.
stream.
As you
As you
say, my
say,
name
my
is
name is
Amina
Amina
Musaweheli.
Musaweheli.
I'm
I'm
Somali
Somali
lady,
lady,
but now
but
I'm
now I'm
living
living
in
in
United
United
Kingdom,
Kingdom,
23
23
years.
years.
And
And
the
the
mental health
mental
is
health
our
is our
daily
daily
life,
life,
how
how
we keep
we keep
our
our
physical
physical
health
health
and
and
everything.
everything.
But
But
to
to
me,
me,
I am
I am
advocate about
advocate
the
about the
mental health
mental health
And
And
my
my
theme
theme
today is
today is
it is
it is
okay
okay
not to
not
be
to be
okay.
okay.
That's the
That's
theme
the
that I
theme that
wanted
I
to
wanted to
use.
use.
It is
It is
okay
okay
not to be
not to be
okay.
okay.
And if you
And if
let
you
me,
let me,
I will
I
share
will
with you
share
my
with you my
own
own
mental health
mental health
journey.
journey.
Apart from
Apart
being a
from being a
mom of
mom of
5,
five,
grandmother of
grandmother of
2,
two,
great
great
journalist,
journalist,
and a
and a
long,
long,
have a
have a
long
long
background,
background,
to
to
work in the
work in the
community.
community.
But then
But
even
then
I
even I
have
have
my
my
share
share
of my
of my
mental
mental
health
healthy
journey.
journey.
Thank you so
Thank you
much.
so much.
Thank you so much, Amina. So, I'm happy you've had your own mental health challenges, and I am sure that as we speak along, you'll be able to pull from some of your examples so that people can actually relate to that. Thank you so much for mentioning that, because we were actually, Dr. Mercy and I were actually looking for someone who would not mind sharing their experience and how this has been for them. So let me give the floor now to, give the mic to Dr. Rushi to tell us a little bit about herself.
Yes,
Yes,
thank you.
thank you.
I'm Dr.
I'm Dr.
Ruchi
Ruchi
Sharma.
Sharma.
I'm a
I'm
clinical
a clinical
psychologist
psychologist,
and I'm
and
working
I'm
with
working with
Manipal
Manipal
Hospital in
Hospital
Delhi,
in
India.
Delhi, India.
And I
And
think
I
it's
think it's
wonderful to be
wonderful
a
to be a
part of this
part of this
platform.
platform.
Thank you
Thank
so
you
much
so
for
much
having
for
me
having
here.
me here.
And let's
And
start a little bit
let's
about
start a little bit
mental
about
health.
mental health.
So, whenever we
So
are
whenever we
talking
are
about
talking about
mental
mental
health,
health,
the first
the
thing we
first
think
thing we
about
think
is
about is
illness,
illness,
disorders,
disorders,
struggles.
struggles.
That's
That's
not all
not all
mental health
mental
is
health is
about.
about.
It's
It's
about a
about a
harmonious
harmonious
balance
balance
between your
between your
thoughts,
thoughts,
emotions, and
emotions,
your
and your
behaviors.
behaviors.
And
And
since we are
since we are
having this
having this
all
all
mercy here,
mercy here,
so it's
so it's
basically
basically
having
having
mercy on
mercy on
yourself.
yourself.
Okay?
Okay?
So think
So
about
think about
mental health
mental
in
health
those
in those
terms.
terms.
Yeah.
Yeah.
Okay, so let me start by asking a question, and I feel I want to ask this question to Dr. Mercy. So I'm going to start with the first question so that we see what we think about it from a different perspective, and just so we let our audience knows that everybody who is here today, who is speaking with us right now, they have a background in one or two strong points. And that is what we're trying to pull today. This is a conversation that, as Dr. Mercy has said, we're going to be having it over and over again. So, Dr. Mercy, from your point of view, what are some of the common misconceptions about mental health, and how can we challenge these beliefs?
Thank you
Thank
for
you for
the
the
question.
question.
I want
I
to,
want to,
like Dr.
like
Ruth
Dr.
said, mental health, it's all about creating that balance. It's all about creating that balance. Once you can find that inner balance and connect to yourself, good or bad, the good one is the mental stability, mental wellness. When it's shaking, when it's rocky, then is the mental unwellness. What is mental health? Those things that create distortions in your thought process, in your thinking, in your emotions, in your feelings, especially when it starts affecting your functioning. That is mental health. And please, people, let us not be scared talking about mental health. People can easily say, I have diabetes, I have high blood pressure. But it is hard for people to say, I have depression, I have anxiety. I'm so happy that Amina is here today. She will be sharing part of her story. Oh my God, I cannot wait to hear it as well. That is mental health. When it creates that unbalance for a while. So sometimes these things are acute where you experience it, then you bounce back up. But when it prolongs for a while and it becomes your norm or a routine behavior for you, then you have to seek professional help, because you may be not just mentally unwell, but you may have a diagnosis that needs to be treated. And this is where people just get all these misconceptions. Oh, she has mental health issues, stay away from her. No. People think because you have mental health issue, you're violent, you behave differently from other people in society. It may come to that, especially with some illnesses like bipolar and schizophrenia. It may come to that when not properly addressed. But no, people with mental health issues are not violent. You may be living with one right now and don't even know that they have mental health issues. They work, they function, especially when addressed, when managed, they work and do everything like everyone else. You may just not know it. People with mental health issues are not violent. They don't behave any out abnormal than any other person. Another misconception that people have is that, and sometimes this is why they don't want to go for treatment, because they are thinking the treatment process like the olden days. You will be locked up in a room in chains, they will beat you up, you may be straight jacket. No, especially in those days when they normally do like shock therapy and all that. A lot have been modernized today to be able to help people with proper treatment, to the point that treatment is not as brutal or almost as harmful or heartless like it was in the past. So for you to have mental health issue and be open about it, do not be scared that that is how you will be treated. Another myth that people have is you will be on medication forever. No, you will not be on medication forever. You will not be on medication forever. Sometimes you may not even need medication. If needed, yes, and follow your doctor's advice. But it doesn't mean you'll be on medication forever. Depending on the severity and depending on your body chemistry, on how you adapt and tolerate medication, yes, some people may be on it for a long time to continue to manage their mental illnesses. But it doesn't mean you must be on medication or you will be on medication forever. A great misconception that other people have is that when you have that mental illness is not common, that it is very rare. It is not as rare as we think. It is not rare at all. Everybody, even us sitting here, everybody, it affects every race, every gender, everybody can have mental illness. It is not rare at all to have. Not at all. Sometimes you think that if my parents had it or if your parents had it, it is genetic. You may be predisposed, but do not live in the fear that, oh, yes, because my mother had something, my father had something, I will have mental illness as well. Please do not live in that fear. You are predisposed, you are at higher risk of it. It doesn't mean you will have it. Let that thought instead motivate you to live a healthy lifestyle and not to make you just fear and keep fearing about it until you start having it. Also, it's very common, especially in my culture as well and everywhere. When you have mental illness, they think that you are crazy, you are cuckoo, you are insane. No, no. Those are very derogatory comments that should be avoided at all costs. Please. And this is why people get stigmatized and do not seek help, because the society has already stereotyped them as crazy. No, not everybody with mental illness is crazy. Please let us stop using those words. They may be mentally challenged. They may be going through that period of distress, distortions. They are not insane. So I hope that helps, Adeline. I hope that helps everyone out there.
Adeline, we're not able to hear you.
Okay, I can hear you.
I was muted. You're right. So I wanted to thank Dr. Mercy for such an elaborate explanation on the misconception on mental health. Now, I know the speakers dynamics that we have are speakers from different parts of the world, and after this deep analysis of what mental health is from a medical perspective from Dr. Mercy and also from traditionally from where we come from. I want to find out from you, Dr. Roche. In India, are there any misconceptions that Dr. Mercy has not mentioned in regard to the local community?
I'd just like
I'd
to
just like
add
to
one,
add
which
one,
is,
which is
I think,
I think
a common
a common
misconception that
misconception that
it's a big
it's a big
weakness.
weakness.
If
If
somebody
somebody
is having a mental health struggle, is undergoing a mental health struggle, they're usually considered or looked upon as weak. That, this person cannot take care of their emotions, cannot handle their own thoughts. And usually people tell them, oh, don't think like this, think positively, as if it were a switch, it's dealt with in such a bad way, and there's so much of stigma attached to it. And particularly if you ask about India, there has been a lot of misconceptions regarding mental health issues. One thing, it was still is in certain parts of India considered a rich person's disease, that only a certain particular strata of people or particular group of people has these issues. And if somebody comes up and even wants to talk about it, there's no safe space to talk about these issues. So yes, more or less, Dr. Mercy has covered the misconceptions.
What about you, Amina? I know your community is also might be similar to Mercy's, but is there something that you feel is a great misconception from where you come from? If you want to unmute your mic, then we'll hear you on first try. So,
Yeah,
yeah,
thank you.
thank you. Um,
The
the community.
community I come from, Somali people, we are African. We are not different from other Africans, but we have our own misconception. Like you have a gene on your body that you have got, evil eye, or someone do, black magic on you, something like that. And the stigma in Somali community, the community I came from, are still, you know, money, big stigma they have. Um, but now, not only me, but there is a lot of Somali community people who are living inside the country or outside the country, men and women who are fighting on this. So now you think it's going to change, but that misconception is always be there. And Somali, they are Muslim people, and then they believe another misconception about, as far as you are a good Muslim, you could not get mental illness, which is really wrong. There is no medical evidence in there. Yeah. So they said, oh, go and pray 5 times. Yes, I pray 5 times. I was praying 5 times when I was getting depression. Yeah. Because mental illness not causing gene, not causing evil eye, not causing not brain, but it causing, you know, uh, chemical imbalance on your body. So that whether you are Muslim, whether you are Christian, whether you are, whatever faith you have, you can get it. And statistically, as doctors and experts told us, everyone who is living in this world can get mental illness once his or her time, once a lifetime. Okay, so that you can get ill. And yeah, I got ill while
I had,
a good job, money, and living in United Kingdom, which is civilized country, have a husband, has a kids, has a great thing. Then I got ill. Russia. I was journalist who's working the BBC World Service. I was have to read the news. Translate the news from English to my language, Somali. I had a great responsibility upon me as a mother, as a wife, as a carrier, yeah, as a breadwinner of our family. And then I got ill.
wow.
Yeah. And then I got
Wow.
ill.
That is such a
So-
powerful
Yeah,
confirmation
so
from
I
you.
had no idea what that description. That's good. But mental illness is a mental illness. It is there. It is
It is
about your
about your
lifestyle.
lifestyle.
As far
As
as
far
you
as
change
you change
the part
the
of
part
life
of life
who's
who's
causing you
causing
that
you
mental
that
illness,
mental illness,
you will
you
get
will get
you don't
you
get ill,
don't
you
get
will
ill,
be
you will
fine.
be fine.
That's what
That's what
I had to
I
do
had to do
I mean,
because I
why
was
are
in
you
because I
still on
domestic
the
was in
violence.
domestic
screen?
violence.
I was
I was
everything,
everything,
and then
and then
I just
I just
changed my
changed my
lifestyle.
lifestyle.
Let me
I,
ask you a
I
question,
I
Amina.
yeah.
Just a minute. Let me ask you a question while you're still on the screen. Now, you've mentioned, how it affected you. Now, our next question was definitely going to be about creating a safe space for people to talk about their mental health. What do you think was not there for you? How can we create a safe space for people to talk about their mental health struggles?
To be honest, when I was starting talking about mental health journey, there were no safe space to talk. But I have been brave. I have been brave. How I have been enough brave to talk about because I know if I kept quiet, no one else is going to talk. As a popular Somali lady, if I talk about the mental health and my mental illness journey and my depression time, then other people will come out and talk. And that is what happened right now. What happened right now? I share with them on YouTube channel. And now, after me, everybody come out one by one, whether it's a mother, whether it's a single mom, whether it's the youth, whether it's the men, whether it's the women, they start talking. So if you just wait a safe space to talk, no one is going to give you face safe space. So you have to be a brave enough because when I was talking, I already fine, beautiful again. Kids grow up, got my own, company. I changed all that lifestyle which was causing me illness. Yeah, I get rid of all of them. And then I become a voice of Somalis, for mental health. Yes, I was a voice of Somali people for another different section. But I became a voice of Somali people about the mental health. And now, if one Somali, whether they are living Australia or America or Somalia, they keep contacting me. And I'm not a doctor, but
But
I am
I
a
am
good
a good
advocate.
advocate.
That
Yeah.
is that is a typical, your testimony is a typical example of what some of us, we jump and we advocate for things. And I love the fact that you've said there was no space for you. Now, I would not beg to differ, but I want to listen from Dr. Mercy, because I know from time immemorial she might have something else to talk about being a safe place. So I want to see two things coming out of what she's going to say. You don't want to accept that there's a safe space, or there is no safe space. So, Dr. Mercy, from your perspective, I know you're a practitioner, and I would like you to share with us what you would consider creating a safe space for talking. It is true that Amina became a voice. She was courageous. She knew that there was something wrong with her, and expressing herself actually made her to basically understand that, okay, because people will come back to her. So, Dr. Mercy, over to you. Let us know, what would you consider creating a safe space for people to talk about their mental health issues?
Amina, from the bottom of my heart, what courage you have. Especially it's not random, like today you will just see people with truth like, oh, what is that? What courage you had. I applaud you for that. And I think in that process you may not understand that you did not only save yourself, but you saved many others. Even some people who could not come out and talk, just seeing that bravery that you exercised, they could also go home and think that, okay, I am okay, I can do this, I can do this, I am not different. Because sometimes with mental health you start feeling like, am I cursed? Is something going on? Why am I not able to process this like A? Why can I not do this like B? So you are a shiro, Amina. You're not just the voice, you are a shiro, and I applaud you so much for that. This is the reason why people don't talk about mental health. This is one of the reasons. They do not find that space. As soon as they open their mouth to say something, they feel judged. Like Dr. Rusi said, even to their friends or to their family, they start looking at them very differently, like, oh, they are weak. Oh, something is wrong with them. Oh, let's leave them aside. Oh, that's how they have been behaving. That's why they are doing this way. Meanwhile, anybody can do it the same way. So there's nothing wrong with people who have mental illnesses. So thank you for being a Shiro, for being a voice, and for speaking out. When people do not feel that they will be listened to, then they don't have that space to talk about mental health. When people feel judged, when people feel criticized, they don't have that space to talk about mental health. When people do not think that we can, especially we as practitioners, we can validate their feelings, can understand that, okay, this is what they are going on, and show empathy without dismissing them, then they don't have that space to talk about mental health. We have to create that confidential environment, confidential, non judgmental, inclusive environment where it is safe enough. If they want to sit on the floor and lament, so be it. I always tell my patients, this office has 4 walls. Please feel as safe as ever. You're not being judged. And I need to know, because if I don't know to the depths of it, sometimes I cannot help. So please let me know, knowing that it will stay between us, knowing that me trying to know is not to judge you, but to find the right possible treatment for you. And everyone, a practitioner or not, everyone should be willing and should have that ability to be assertive enough to create a safe place for everybody. Millions are killing themselves every day. Most of the time, it's because they did not find a safe place. They did not find anyone they could trust enough with their thoughts. They could not find any place where they can go there and feel solace and feel accepted. So, in creating a safe place to talk about mental health, I wonder how many lives we are going to change or we are going to save from killing themselves. So that is a great question. Amina, you are a Shiro. You are my Shiro for today. Thank you so much.
Thank you, Dr. Mercy. Very briefly, Dr. Rushi, I think Dr. Mercy has told us, she's told us about, she's kind of mixed the practice and the layman's way of looking at these things. And I love how she's blended all this together. So if you were to add something with regards to safe, creating a safe place for people to talk, what additional thing do you feel you want to add to what she's just said?
First of all, Amina, thank you so much for sharing this. I think that in itself created a space, lot of safe space for a lot of people watching this today. To come up with their own mental health issues and be brave and talk about things, especially with you sharing this on this platform. So kudos to you for that, right? The other thing is, yes, if I'm to look at it from a practitioner viewpoint, I would say that you were in the midst of adversity and you sort of made a path out of that. You carved a path out of that adversity. But for a lot of people, who might not have the same kind of personality traits as you, or who might not feel as brave as you, yes, we need to talk about creating that safe space for them, because they need to know where to go, right? So a lot, yes, I completely resonate with what Dr. Mercy said. Along with that, I think things need to start from the family itself. Every day, just like, people are getting together, having dinner, watching TV, or doing anything as a family, they need to start talking about mental health issues as a family. At least at the end of the day, or whenever they're getting time together in the weekend, they can at least sit together and talk about how each person in the family is feeling, or if they were having any disturbing thoughts. Second thing is not to undermine other people's emotions and thoughts. When they are telling you something, the least you can do as a human being is to listen. That, okay, if you're going through this, okay, I'm here, I'm listening to you. Just be that listener, lend that ear. I think that would work wonders for a lot of people, who are working through their challenges. Thank you.
So much. While you are still on the screen, I want to pop this question because as you're speaking, a lot of things are rolling through my head, and I just want to pop this question so that you can continue. What are some of the role that practitioners, schools, communities, policymakers, what role can they play, to address the challenges that we have, not just in raising awareness, but also to help, solve this problem of lack of the knowledge of mental health and lack of the knowledge of lack of the ability to accept that this is a situation and to seek help. What role can they play? Dr. Roshi, I'll still bring you on my solo because in a minute we're going to be taking Dr. Vivian, who is waiting in our room. But then let me put you solo so you can give us, some of the ideas.
Yes, so
Yes, so
I
I
would
would
just
just
briefly sum
briefly
it up.
sum it up.
That's
That's
any
any
stigma
stigma
related
related
to
to
mental health.
mental health.
It
It
starts at three
starts at three
levels.
levels.
One is at the
One is at
structural
the
level.
structural level.
There is
There
where
is where
policymakers would
policymakers
come
would
in.
come in.
Adeline, I think
Adeline,
your
I think your
mic needs.
mic is
Yeah, thanks. So that's where the policymakers would come in at the structural level to deal with the stigma. If there are legal, processes in place, and if there are policies in place, programs being rolled out by the governments, then in the mass media, it will be really helpful to people to come up and speak about their mental health issues. The second level is at the society level, wherein your schools, the communities would come in to raise awareness, to provide that space to people, either through creating such awareness campaigns or through getting support groups together where people can find safe places to come and deal with their challenges. And the third level where stigma is happening is at the personal level. I think that needs to be dealt with utmost priority. That needs to be dealt with first. If you are yourself having so much of stigma about mental health issues, there's no way you can do anything to help another person deal with theirs. Okay, so at the personal level, it needs to be taken care of. That is where the individual comes in first. That's where the practitioners come in. So practitioners also can volunteer in a lot of places with the NGOs, with a lot of international organizations like the UN, like Doctors Without Borders. So many organizations are providing online mental health support to people. At the school level, they need to have counselors, community support groups where because it needs to start at the grassroots levels. Yeah, only then things can be taken care of. So I think that briefly sums it up.
Thank you so much. I think I like the way you've structured this into different levels, and I feel that you've touched some of the areas where a lot of consideration needs to come from, because sometimes policymakers, because they might be really established or very comfortable with where they are, they really don't look at the community and look at community issues affecting not just the mental health but the well-being of people. Now, before I bring Dr. Vivian up the screen, I want to put this banner on my screen, and I want you, Dr. Rushe, to tell me why this is a quote that you live for.
Yes, I think I had shared that. Yes, because I want everybody watching this and everybody watching this later or at any time, child, they are just struggling through their mental health issues. I want them to know that as a human being, we have a whole range of emotions that we deal with. Okay. We don't need to be happy all the time. It's all right to feel sad, to feel angry, to feel upset, frustrated, the whole range of emotions. You are a human being before you're anything else. Don't ever forget that. Adeline, we can't hear you.
Adeline, you're muted.
want to say unmute yourself. What I'm saying is that I'm gonna put you in my waiting room at the moment so that I bring in Dr. Vivian. But please just stay there for us because we're gonna call you back at some point with some of the questions that is directly related to you. So I'm going to just bring in Dr. Vivian. Hello, Dr. Vivian.
Hi. Good morning, everyone.
Bonjour.
Yeah.
You know, I read your bio earlier and I told myself that I told all the men, because we have a lot of men, you know, I've been seeing from their names on the comment section. I told them that, you know what? Please, when there is an issue, if you have an issue and you feel that she can help, go to her. Just the fact that she said I help women doesn't mean men are exempted. So while you're on screen with us, I want to welcome you. And I know that you've been listening from the back end, but I'd like you to tell us a little bit about yourself so that our audience can warm up with you and prepare the right questions to ask you as we go ahead.
Yeah, awesome. Well, lovely to be here with you guys. Can you hear any echo? It's me. Okay, sounds like it's gone now. Okay, hi everybody. My name is Dr. Vivian Gonging Obiemi. I reside here in the US. My background is in psychiatric, so I work as a mental health practitioner. I see patients who have your depression, your anxiety, your bipolar. So I assess, diagnose, prescribe, and I also do therapy with certain patients. So your depression and your anxiety. Outside of that, I do relationship coaching, so helping with, creating healthy dynamics in relationship, healing, moving forward. And I've been doing that now since about 2016 now. So both the relationship coaching and then the practicing as a provider. So that's been a little bit about myself here.
Thank you, Dr. Vivian, and truly welcome. Let me start by welcome you with a question that has been answered. But because I would like to hear your perspective of this question, not just from the relationship side of, point of view, but also from you as Dr. Vivian, someone who sees, patients upon patients with different issues every day in her day-to-day life. What are some of the misconceptions that people have about mental health? What would you say?
The big thing is that it's problem, there's something wrong with them, right? So a lot of the times we think, gosh, what's wrong with me? I don't know why I'm feeling this way. And then people don't have someone who they can speak with. So then they feel lost, right? So people are feeling like there's something wrong with them. When in essence, I tell people like, hey, if you have a heart problem, you go see a cardiologist, right? And like, that's just taking care of your health. Like mental health is just another health thing, right? It doesn't mean there's this problem necessarily, right? You're not going crazy. That's not what we're defining it as. You have a health issue that we need to figure out. And that's what we're going to do today, right? So don't leave your thinking there's something wrong with you or society telling you there's something wrong with you because you have this mental health thing going on. That's what I see. I'm sure it looks different in, different sections, right? I've worked with some Black, African American, patients and stuff. We lack the words to put as depression and anxiety. So it's hard to relate that in a way that makes sense to them, right? So they might be experiencing mental health things, but it's hard for Africans to define those mental health problems as an actual, thing that's going on. So because of that stigma and lack of ability to articulate how they're feeling, it makes it hard for them to even realize they're going through some of those mental health things. So that in itself can be a stigma for our population because sometimes we lack the vocabulary to articulate what's actually happened. And then it makes it hard for the provider to diagnose, right, what's going on, because a lot of our assessment is based off of what they communicate. Like a patient may come and I can clearly see that because of their history, they probably have PTSD, right? They've experienced trauma. They've had this happen to them, but they would tell me they're fine. But their family member will say, no, this person doesn't talk. They don't smile, right? They're not their normal self, right? But because of this lack of vocabulary to articulate some of those things, it can make it hard for people to get the help they need for our population sometimes.
Wow, now that you're speaking, the more you speak, the more I try to figure this out. Can we link this? I mean, this is not part of the question, but I just want to, since I'm in front of practitioners, can this be linked to the way we bring up our kids, for example, because in Africa we are not expressive. You're not allowed to look at someone who is older than you in their eyes. You're not allowed to speak how you feel. So I think from the very beginning, our feelings have been suppressed so much that even when we're bigger, I don't know if that has ever been linked to that. I mean, Dr. Mercy, Dr. Vivian, either of you can tell me if I'm right or if I'm just, bringing my Amina journalistic cap in on my head.
No, I agree. One of the big things is cultural differences, right? In our culture, African culture, we are taught we're really good at suppressing, right? And suppression is a coping mechanism, right? So I can't even be mad at us, for using that as a tool because it is part of a coping mechanism. But there's an extreme to everything. There's a point where we can suppress things and it is a positive coping mechanism. And there's another extreme where we're suppressing things that we need to talk about, we need to address. And when we don't address some of those things, it impacts our mental health, right? That on top of the lack of vocabulary, the words, we don't have those words to describe those mental health issues. That's another barrier to getting some of that help.
Well, absolutely. Now, talking about that, Dr. Mercy, what are some of the ways? I mean, you can link it to the previous question about not being able to express ourselves or using the right vocabulary to say how we feel or even accepting it. But linking this question to that question, how will you relate the fact that that is happening? Yeah. And someone else might be able to identify that because they've been made aware, and and they know it could be you, it could be somebody who is just a little bit more assertive. So how can we support friends or loved ones struggling with mental health issues, taking into consideration that one, they might not even be able to articulate how they feel or to communicate these. Two, they will not come to you and tell you I'm feeling this way. Three, you have seen them and you know that this person, there's an issue. How do we support them? Over to you, Dr. Mercy.
Dr. Vivian, thank you for that. And nice meeting you, Dr. Vivian. You said one thing in particular. They don't have the words, they don't have the lingo for it. And we can clearly see that there is a problem, but how do we address it? They are saying one thing, their body language is saying another thing. Somebody can be in your office for up to 30 minutes and cannot even create a routine eye contact with you, but they are telling you, I'm fine. Some of them will even tell you, oh, my doctor sent me here. I don't even know why they sent me here. I'm fine. Everything is fine. You can clearly see something is wrong. First of all, before coming, they don't know what to expect. One of the hardest things as individuals, as human beings, is to accept that you have a problem. And because of the stigma in mental health, people can easily say, oh, my head hurts. I have a headache. I have stomach ache. But we have not been trained to easily say, I don't feel good about this. I think I have been sad for a long time. It's like it is not allowed to say how you're feeling, to the point that they suppress it. To an extent, like Dr. Vivian said, it can be a coping mechanism, but to an extent, it becomes very destructive. You suppress something until one day it just come out in different ways. And most of the time when it just blow out, it comes with a negative impact. So we see that in the society, we see that in our children, we see that in our patients. It goes again to create that safe place. It starts with us at home. As a family, there should be that openness because families create a community. There should be that openness to say that, Mom, I don't feel good. Mom, this is how I feel about this. Mom, this we should, or something. You see something, you notice something, don't let it go. Talk about it. When you talk about it as a parent, that child becomes open to you as well to talk about it. It goes to the community, it goes to school, where teachers create a safe environment for their students to talk to. That's why I don't like when schools always cut out. Oh, because of budgeting, we will only have one counselor this semester. One counselor for how many pupils in school? How many students? So that is not something that should be relegated to the background when it comes to mental health. We should be open enough to talk. We have suppressed it so much that it is like almost a shameful thing to say, you know what, I've been dealing with anxiety for a long time. People feel like admitting their feelings is a problem. So no. And because of that, they don't think about it. They just dwell in what they are going on. They dwell in those feelings, and dwelling in them, sometimes it doesn't even help you understand yourself. What it does is just help you stay in that spot instead of seeking professional help. And sometimes all you need to do is tell your parent, tell your friend, say, hey, this is what I'm going through. What do you think? Get help. Get help. Read about it. Understand it better. And again, if we don't know, then we don't know how to treat it. You're telling us something, your body language is telling us something else. And we want to maintain that confidentiality. We want to listen to you. We want to validate your feelings. But if we are seeing something else and you're saying something else, then we have to close the gap to that bridge. Because if you don't trust me enough to treat you, I may not be able to provide you with the right treatment. Most of what we diagnose, most of what we treat, most of what we understand goes by communicating. Either by what family member is saying, by what you are saying, by what your body language is saying. It goes by us looking at that communication. It's not like we can diagnose malaria through a blood test or typhoid through a blood test. Most of the time with mental health, when we are doing blood tests, is to test for drugs, it's to test for your levels of your medications and things like that. It's not like I can do a blood test to test depression or anxiety. I rely on that communication from you, from your family, from friends, from loved ones. But if you're not able to communicate, if you're not even able to admit that. So I think today, if we can get one thing today, like Amina said, it is okay to not be okay. It is very okay to say, I am not okay today. It's one of those days. Is it coffee that I need? Is it a friend that I need? And I have friends. Sometimes, do you want me to listen or do you want me to comment? Sometimes you may just need a listening ear to vent. But if we do not know, we cannot treat. Let us stop suppressing that feelings. Let us air out our mind. It's such a relief when we even talk about. My grandmother used to say, a problem shared is already half solved. It is such a relief. Take it off your mind. Don't walk around dragging heavy. It's a heavy burden. And the more we don't share it, the more we don't talk about it, just become heavier. So thank you for that point, Dr. Vivian.
Thank you so much, Dr. Macy. I kind of related with what you were saying because, to be honest, the community, I mean, what you were saying, I couldn't really have put it any better because sometimes I have these feelings, but the way you've put them all together in a very chronological manner has broadened my horizon, my thoughts, and has made me to even ask myself some deeper questions. That said, I want to link what you said to Amina before I get Amina a little bit out of our studio to bring in Reverend Georges. I want her to tell us, as someone who's been there before, who is wearing the t-shirt and proudly as well, because wearing it proudly simply means being able to come out here and talk about it without any reservations. So, Amina, tell us, what are some of the supports that you got from friends? What are some of the support that you would have loved to get from friends? And if you were seeing a practitioner, how was that? Is there something that they would have done differently? Or did you just snap out of it because of you going out there and just saying it? So I'll bring you on my screen and I'll really be keen to see what you say. You will need to unmute your mic, Amina, so that we can hear you. Thank you.
Sorry, I forgot. Yeah. Actually, what I'm doing now, it's what I got experience, from my illness previous 20 years before. My time, I did not get much help from the community. And every Somali person who I know, or my neighbors or everything, they they advised me not to go to the doctor. But then I did not listen. I went to the doctor and got help. I got therapist, I got mental health counselor, I got psychologist. So all those efforts, that network, I got much help, and I just become okay. But when I was coming out and go to the doctor and admit, that I am something wrong with me, because I have no idea what is wrong with me. I have no experience about the mental illness. I came a country who, I can see in history the people who are naked, and the other people, children, women, they are stoned at that person, saying, hey, crazy, hey, crazy. That is the background, the community I came from in Somalia. So when I came here, I just realized that I am not that Amina, that girl from Somalia. I am not the same person. So that I seek advice for my Somali community, but they all against me to go to the doctor. They said, you have a small kids, the doctor will call the social services and they will take away your kids. But I was brave enough, alone, my own decision, while even my mind is not stable, to go to the doctor. And that is where my helping hand started. But now I am helping others, because I was going to, I went to the doctor while I was saying it's okay not to be okay. That was what I believe. And now I help my community through my YouTube channel, through my podcast, through face-to-face. Some of them, I accompanied them to the doctor. Yeah, it will work. And then accompanied them to the doctor, and then help them, be, a listening ears, whatever they are saying, even if they are saying something which is not making me sense. Yeah, because that was what I wanted when I was ill. And I have been listened by my doctor, by my therapist, by my mental health counselor. And that's what I'm doing for them now. So the more you help that person, you show, empathy that person, that you are listening, whatever they are saying, that you are ready to help them, whatever they need you, and not judging them. Important is not to judge them, not judging them. Yeah, then you are in better place to help your community. That's what I did, and that's what I'm doing right now. I am listening mothers who are single mom. I am listening a mother who are still in the situation that I come out. I have been there. I have been a violent situation, violent marriage. They are like me. I have 5 young kids who, the youngest is just 1 month old. Yeah, when I was ill, my youngest daughter, now she's in university and learning pharmacology. She was just 1 month old. Even one time of my life, I wanted to commit suicide near the BBC where I work. I went to the River Thames and I wanted to jump, but I was big enough and I was 8 months pregnant. I could not able to climb on the bridge. So, because God had saved me that day, or I have been not here. And that daughter that I was pregnant, she's 20 years old, going to university, doing what she has to do. Yeah, and beautiful girl. Another 4 boys, they are all alive, and they have still their mom. Yeah. So I have been there. So I have some real, not theory, not something that I read from book or watch from movie. This is a real history I have. I can share the person over and over again. And the people say, oh, Amina, if you got out for that situation, so am I. So I am a living, experience. I am a living witness. Yeah, I am a living witness. Not only Somali people, but every woman, even every woman who came from, Africa, because all the African women, we are same situations. So I am their living legacy. Yeah, and I can still, and I'm happy. And I got out all that hardship, and now I'm in a position to help the others. And I'm here, and I'm be there for them whenever even I see in the middle of the night, some of them call me. I don't say, oh, I'm sleepy, I can't talk to you, call me back tomorrow. I don't say that, because I remember where I have been. And I had no person, no one that I talked to, no mom, no cousin, no friend. I was all new in this country. And I was breadwinner and working and playing, professional. When you are, a newsreader, a producer of the day, you have to be professional. But I was burning inside. And I wanted to kill myself. I was thinking about how to kill myself for 2 years in a row. How to kill? Do you go to bush house up and then, jump? Are you doing this? Are you doing this? Yeah. And then I wanted to jump through the River Thames, and I don't know how to swim that time. That was my situation. And now I can talk to anyone who is ill, even small, youth who born abroad, but their background is Somalis. They call me. They said, Mom, what can we do? I'm not feeling well. I listen and listen and listen and listen them, make them happy, tell them stories. And then I advise them to go to the doctor. You have to get help. That's why I started. I trusted my doctor. Yeah, because I was ill. You have to trust to your doctors, to the doctors. You have to get a help, whatever help which is available for you. Yeah. Some people are very lucky and they don't know they are very lucky. Some people, they don't have even, a doctor to go in some countries. But you have a doctor to go. Go there and talk to them. Tell them you are not yourself. You are not feeling yourself. That's what I told. I have no idea about the depression, no idea about anxiety, no idea about psychosis, no idea about stress even. But I have learned through that. And then after that, I went to the university and start psychology because I wanted to understand how the, human being mind works.
Oh my God.
My journalism.
I mean, I can't, I can't stop the tears from rolling down my eyes because your story is so real.
Yeah, and then I went to training as a mental health counselor, and now I have level 3.
Oh, wow.
Yeah, level 3. I achieved level 3.
Oh my God.
At the same time.
Oh my God.
I am a living experience.
You are. I don't even know how to keep the light of this conversation anymore.
I don't know what to say. But that's who I am. And that's how I can help. And I'm still willing to talk about mental. I will never get tired.
I mean, I'm going to ask you to stay in my studio for a minute because I would like you to give us a powerful conclusion message after Dr. George's have popped up. Your story has just broken, the momentum that I had when I started this. I was full of high spirit, but I don't know how you've operated and dissected this mental health. It is raw. I feel as if I can touch it because you've touched some really raw nerves in me, and I keep looking at my background sometimes and I'm asking myself, where was I at that point in my life? So you've just made me to believe that we, just as Dr. Vivian said, we've all experienced mental breakdown.
Yeah.
So I'm gonna pop you back in, and I'm gonna bring you back just before we close.
And
But
I
Miss
very, very quick. I mean, I'm getting so many messages for making people crying. I am getting so many messages. You're my Shiro for the day again. And you said something that just my one of my patients also went through, or so many people go through, afraid to speak as a mother because they will take your children away from you. That is not the case. The only time that happens is if we have assessed that you are physically, emotionally, mentally incapable of taking care of those children, and that puts them at risk or a danger to you. So it's not like we are calling child protective services. Or no, you have family, you have friends. It's like a respite care. It's like, okay, you need a break. Let someone, because it's so much tasking having all those other not just opportunities but responsibilities, 24-hour responsibilities of a child. You have a 1 month old, you're pregnant, so people are scared to talk. Mothers go through postpartum depression and they are scared to talk. Oh, it's just the baby feeling. Oh, it will go away. Oh, what if I express what I'm going through? They will take my child away. That is not the case. Even if you don't have any family or friend, and a stranger or somebody from child protective step in to take the child, it is so that you can get help. Once you are stable, you get, do you want to take care of your children or of your family broken? Then you will just break them as well. Or do you want to take care of them as a whole person? So, and sometimes you're just delaying that process of getting help, because when it explodes, it will explode. Amina, Shiro, voice, I'm not sure what to call you anymore, but you have made an impact. You did not just save your life, you saved so many lives just by speaking. And I want to applaud you again, how you're taking care, you continue to take care of your community and other people through social media and everywhere. It's really an honor meeting you. I'm so blessed.
Thank you, Dr. Mercy. Thank you. I mean, I'm going to bring you back. Please do not go. Let me bring let me bring Reverend George. And while he's coming, I'd like Dr. Vivian to tell us about the roles that practitioners, schools, and communities can play. So I'm going to add him on the screen. And Dr. Vivian, you're going to tell us about the role that practitioners, schools, communities, policymakers can play.
Yeah. So one of the big things. I think I can hear my microphone.
That's me. I'm just going to mute myself again.
That's okay. So one of the big things that's happening now, at least in the US, is this whole broad acceptance of mental health. There's advertisements for mental health clinics, online things that can be accessible for people who have mental health. So there's this, new profound acceptance, right? And saying it's okay if you have mental health, let's talk about it. So a lot of things are happening where there's a social shift, and it's sometimes sad where it takes like society, to make it okay for people to feel like they can talk about these things. But on the other hand, it's also a plus that we're getting society on board, where there's advertisement that says it's okay for you to have mental health things. Here are some resources. So just even on the social term and community term, it's being okay to have these conversations. As a practitioner, we are always available, right? And I think that what we talked about earlier, some people don't know they're dealing with certain things. but we can serve as advocates, right? Having platforms such as this where we can address these topics, make it okay for people to share what's going on in their lives. So having these kind of conversations to raise awareness and break that barrier and stigma can really help with getting, mental health access to everyone. On the school level, schools tend to do a pretty good job of having counselors on board, right? They have people who can provide therapy, counsel kids, and they can have like special programs for kids who have maybe ADHD, right? Maybe special needs, things like that. So they will create different systems in place that can help kids who are struggling with, certain mental health things, and create programs that makes it easier for them to be in the school system. On a policy level, so for example, here in Minnesota, where I'm at, like there are changes where it's having practitioners be able to practice independently on their own without needing a physician. So in that way, we can have telehealth visits to people who live in rural areas. We can have people join us online. It doesn't have to be just physically, and we can prescribe and send medications for those patients. So things are gradually changing on all levels, and I'm really glad to see that it's now a social norm to talk about mental health, and hopefully that will be the continuum of how mental health will be, where it's easy to talk about, we can get the help we need, and we can raise platforms such as these to help, spread the word about mental health. So that's a little bit on that.
Thank you, Dr. Vivian.
Let me
Thank you.
just
Okay.
let me just continue, please, with education, with exposure, and being a postmaster person. Dr. Vivian, you agree with me that we have a lot of resources to influence policies. We have a lot of resources to influence how insurances are made, not having the component of mental health covered as well. We have a lot of things that we can do. It may lobby, it may not lobby, but our consistent and relentless effort, I think that would also be a wonderful way to influence what we as a community, we as a nation can help take care of this, because insurance will cover everything except for mental health. Why not? How many people have the resources to pay out of pocket? So that's one of the reasons why people just sit back and do not take care of it. So I just wanted to throw that there. We are more exposed, we are more resourceful to be able to influence policy and lobby and do what we can do to make sure that mental health is not just mental health issues for those insane people. It is a health issue and a social issue as well. And everybody, including the government, need to play that role and make sure that we are taken care of. Mental health people are taken care of, not just other medical health issues. What is health without mental health? What is health without mental health? So we need to fight our lobbyists and all, so that they can start covering those mental health issues. We see even now some insurances who cover mental health. They'll cover 80% this for medical issues, then 20% for mental health. Then the patient is left with bills. Then we wonder why they are not seeking help. We wonder why the suicide rates go up. We wonder why all of a sudden, what is bipolar most of the time? Most of the time it's because it goes untreated and it just becomes severe and explodes. We wonder why we are not able to treat it when it just started until it becomes severe. Those chronic illnesses, most of the time, is because when it was acute, no one bothered to address them. So I think we are more resourceful now to take care of those issues.
That brings me to this question. I don't just want it to go unannounced. Dr. Mercy and Dr. Vivian, you talked about leaving it to or letting it affect the person till it's late. How do we diagnose a mental health issue, especially in kids? I know, Dr. Vivian, you've mentioned some elements which I'm not versed to repeat because you are the practitioner. So I'd like you to answer this question. This is coming from Nancy.
Yeah, no, that's a really good question. But like what we were saying earlier, so with diagnosing mental health, it comes with, some of the information we get from our clients. That could be through, a parent who sees that child every day, will get information from the school. So yes, a child may not quite be able to articulate certain things, but if a parent is noticing, maybe this child has a hard time really sitting and focusing on doing activities rather than, maybe what his sibling normally would be able to do, they can identify that clear distinction. Maybe that child goes to school and rather than being able to sit, they just want to bounce around, bounce on the ball. They can't sit and focus, right? So we kind of see like, okay, maybe something needs to be addressed, something needs to be assessed. So through the information from the parent, we'll get information from the school. We can use that data to be able to diagnose that child. That child might have ADHD, right? So it can be sometimes hard to see that in this child. But when we can see when normally you should be able to sit down and focus, do certain things, color for 10 minutes, and this child cannot do that, that lets us know like, okay, we need to dig deeper a little bit more and assess that. So we'll gather information from those resources to be able to diagnose that child. And that goes the same for adults too. But typically, adults will be able to vocalize for themselves what they're experiencing and what they're struggling, and we'll use that to diagnose them. Looks like you're muted.
I just want to jump onto this question. What are there some food? Someone is asking. This is from Patriotic Mola Nestor. Are there some food, that are determined to the mental health? What can we do to maintain a safety mental health or Mercy Psychiatry? So I think that's a question for you, Dr. Mercy. If you want to quickly wrap on that, if there's any food.
So, for detrimental food for mental health, we always say eat as healthy as possible for your general health and yes, for your mental health. You have things that can promote more cognition, like ginkgo biloba. You have things like ashwagandha that can help you with stress. Those are natural stuff that you can take. But also, we know that a lot of fatty foods, lack of exercise, a lot of caffeine can also help cause a lot of anxiety. So when it comes to food and mental health, we also say eat healthy, follow your doctor's recommendation, and eat healthy. Now, some triggers, like some people go all day with caffeine, it doesn't affect them. But some people realize that with caffeine, they get a lot more anxious. And without caffeine, they start experiencing withdrawal symptoms. So it is sometimes relative what is good for you, what is happening in your blood chemistry. But eating healthy is key, whether mental health or no mental health. Eating healthy is always key.
A little bit about yourself, who you are, because I know that some people might have missed you and some are just joining now. So over to you. I think you're muted, so the first thing you might want to do is to unmute yourself. Let me add you to stream. I think you've got two open, so I'm gonna take this one out. Is that okay? Can you hear me? Can you unmute one of your... Okay.
Sure, but I did not hear the question.
Okay, I just wanted to tell us about yourself because you are the, our only male guest for today. So if you tell us about yourself, because some people are joining us just now, so they might want to know who you are. You have to unmute yourself again. I'll add this on the screen. I'll take that out. But this one has no video.
Is it okay now?
This one is okay, but the video is not working, so that's fine. Let's...
Okay, well. Okay, but I am not getting you anymore.
Okay, can you tell us about yourself, who you are?
Okay. Good. Sure, it's sometimes very difficult to present myself because I wear many hats. However, just to begin with, I am a servant of God or a clergyman. I am a pastor for more than 15 years now, but also I love young people. And my passion for young people is because of what I went through personally when I was younger. And just to pass a little bit from that, I have spent some time in the streets. So I have tasted a little bit what it means to be in the street as a street child. That is why today I am very, very bent towards assisting young people. But including that, I am also an online mentor with digital strategies. And this is something I will say when I see a topic like mental health. It goes to my heart because with digital strategies, we are there to listen to people, to show them love, to talk with them, and also to guide them towards resources, particularly when it has to do with mental health and many of the related issues and all the pains that people are going through in the world.
Thank you. Now that you've joined us, I mean, it's a good thing that you were at the back listening to all these wonderful things that the doctors have said, and that Amina has said. Sharing her example has truly been typical. There's a question back in that I think this question you might want to answer this question, because thank God you are a man of God. Prayers could be used when one is negligent as well. Because this question only popped up because someone said, I just want to make sure I get the right question, but someone said you can pray. Prayers can cancel mental illness. If you don't pray, you will have the illness. This is from Gumdilis. I want you to please tell us if this is fact, or what you think about it.
Well, I cannot just go and attest. But I will share my own story, which might show where I weigh in the question. For more than 15 years, I have been talking with members of my church or people around the world, particularly with our online mentoring platform. And most of these people are Christians. By the way, I had to go through a training as a mentor. And this training, it's true, linked with the Bible passages and many, many other things. But I cannot for sure say that if someone is suffering from mental health and with a prayer, like I will prescribe a prayer for that person. Now I wonder which words will I use to prescribe to that person. I wonder how long should the person pray. I wonder where should the person pray, so that all this will form the prescription to make it whole. But people are dying because of what they are going through without the necessary support. And this support, among other things, as the doctors have mentioned, there is place for prayer. But I will not just mention prayer, because prayer is just one of the things that can be used in this area. Among other prescriptions, we talk about spirituality. And within spirituality, we have prayers that can help bring some calm when you know someone, a heavenly Father, hears you. There is meditation. When you meditate on the Word of God, for example, on your own life, on the future, this can contribute to help solving mental health issues. Not all of them, though, but some. That's not all. We can even talk about relaxing, walking through the woods, refreshing yourself, resting. There are therapies, many, many therapies that can be joined together to help someone tackle mental health issues, than to just go blatantly and say maybe to a prayer, or maybe to, I don't know how to really ascertain, but I think what I have explained shows where I am. I can weigh in on that question.
When you talk of prayers, I can see prayer is that calm place where you can actually find solution. So yes, I will definitely accept with you that prayers can help, because when you pray, you are in a space of mind when you can think clearly, you know. And from what I heard from Dr. Mercy a few weeks ago, mental health starts with when you accept that there is something which is not normal with regard to how you think, how you behave, how it affects you. It could be sleepless nights, it could be, once you've accepted that bit, that there is that thing, then you can take measures. So, what you've just talked about prayers is going to bring me to this question, which I think Dr. Mercy and Dr. Vivian can answer. So, would this be a substitute for the medication? So, Olusola is asking what treatment is available for those that doesn't want to be on medication. So Dr. Vivian, Dr. Mercy.
Yeah, before I go, I want to commend the pastor for what he actually mentioned. I think it's so important that, can you hear me okay? Okay. I think it's so important that as pastors, preachers, whatever, we're able to offer not just prayer, because you mentioned other things other than prayer, right? You talked about meditation there, right? Being able to go out for a walk, get into sun, the nature. So I think it's so important that pastors are not just preaching just prayer, right? Because sometimes it takes medications, outside support to be able to get that, more insight. So I just want to really credit you that you are encompassing both of those worlds in your practice and not just prayer. But in terms of what are other treatments that are available, kind of like into what you were saying earlier, there's therapy, right? So therapy is one of the primary things we will utilize as a non-medication option. So in therapy, you can process things that are happening, talk through the past, come up with coping strategies for things that are happening right now that'll help you deal with your current circumstances. And in addition to therapy, some people will practice yoga, some people will exercise, some people will meditate. For some people, it's getting their sleep routine on a better, schedule. For some people, it's starting to eat healthy, right? So getting healthy and nutritious food that actually help you feel better, right? So some people will do sound therapy, there's dance therapy, music therapy, art therapy. There's so many different forms of therapy that can help you. That's a non-medication form of getting support rather than just medications.
Thank you, Dr. Mercy. Would you want to add to that?
Yeah, I just want to add, this goes again to that misconception that, oh, I have a problem, I have to take medication. We don't just jump into medication except necessary. The first thing that we want to see is there something else we can do other than medication? Is there something that therapy can help? Is there something that we can just sit, weekly talk therapy, mindfulness, something else can help? If it is not getting better, then we can say, let's do maybe dual therapy plus medication. We've seen great successes with that. The only time that you see us for the first time and we say medication is needed depends on the severity and depends on what has not worked in the past. And some people have been in therapy for 2 years. Finally, they are like, okay, something else has to give. That is when we go to medication. Mental illness does not equal medication. Do we need medication? Yes. Does medication help? Yes. But medication is not the first step of treating mental illness, except when necessary.
Thank you, Dr. Mercy. Thank you very much. And I'm going to, before I take on, because we're wrapping towards the end of our conversation, but before I take off our final comments, I'd like to ask the Reverend who've joined us, I'd like to ask him question 2, which I think based on his community activities, he might be able to have some, some referral and some suggestions and some new input, new points for us. So, Reverend George, how can we create a safe space for people to talk about their mental health struggle? Who can we trust? Where should we go? Where shouldn't we go?
I was in the United States, and I have a friend of mine who has been a professor in a Bible school, and he is transitioning, or let me say, he is adding to his knowledge by taking a PhD course in psychology. And as I also said earlier, I myself have taken trainings on mentoring, coaching, and particularly people online. So adding that aspect, this is how pastors are equipping themselves to face the challenge, in addition to the Bible, prayer, and all the other practices that we have been using in other times. Now, talking about safe space, the issue is, unlike in the United States, as two of our panelists have mentioned, they have advanced. They already have a lot of spaces, and these have even translated into schools that are working on helping people with mental challenges, mental health challenges. Unlike that, in Cameroon, in my country, or in most African countries, we are lagging behind in that area. So churches can create safe space. We already have the opportunity of having people trusting God, trusting those who are serving them. Now let us add the aspect of focusing on the mental health of people. Sure, we can offer prayer, but as I have already said earlier, we are adding to that these other practices, these other therapies that can soothe those who are having mental health challenges. When I talk about mental health challenges, yes, in my country, there are two regions that are in social uproar for some years now. And I fear that many people are going through mental challenges, through family one members that are dead, through the pain of not able to go to school, through the challenge of not being able to earn what they were earning before this trouble began, and that their lives are not restored. And some of these members of our dear ones have come into the other part of the country, and they are members in the churches, they are members around the community, and they still are not receiving support. So it really goes to, let churches build space, let them focus. Let schools, this has already been mentioned, let it be taught as lessons in higher education. Let higher education have setups within the campuses that can help students and personnel. I think with what the internet has brought today, we have people who can train, as one of the panelists said, apart from linking it with the medical body, let them be individuals who are caregivers for mental health challenges and so on. So let it be something consciously adopted, consciously invested on, and I hope that in the near future, we will surely grow to be finding it easier to have people talk about their mental health challenges and receive necessary support. You know, as they were talking earlier on also about misconceptions, some even said that Africans don't suffer from mental health issues, you know. But as it has been challenged already, everyone go through from age 5, and the family should be the first safe space for people to receive support. Parents already should be mature and equipped. So why not multiply sensitization seminars, sensitization caravans, so that people will know that, yes, they have this issue, they're accepting it. Yes, there are resources that are available for them. Yes, there are caregivers who can hold their hand, walk through this painful moment, and bring out some solutions. So that's what I can just say, just like to chip in a little bit how it can be handled. But in the context of my country, it should be specific. Churches should include this as a department. Hospitals should include this as a department. Prisons should include this as a department. Schools should include this as a department. And even social workers should be trained to be able to give it when they go out for other issues. I think this will support the work, and people will be saved from this ILO where they are finding themselves, and they can talk as if you say I'm having depression, it's a sin. No, it's a sickness, not a sin. Absolutely.
Wow, Reverend, thank you so much. I think what you've just said nicely tie in with a question that has been asked by Ibironke on the integration of medical, psychological, and prayers. And for real, because we are believers, we can't say no. Some people do not believe, but because we mental, it starts with you, your thoughts, your belief. So motivational speaking, inspirational speaking, it depends who you're actually listening to. You might not go to a psychiatric, you might be listening to a pastor, or you might be listening to an inspirational speaker, and you find yourself healed. So I think that question has nicely been answered. I want us to thank, I want to first of all thank those who joined us today, and I want to let you know this is going to be a continued conversation. We can't have enough of this conversation. We cannot have it. And if you are hosting such a conversation, I want you to know that our speakers are available to join you and help to raise awareness. At All Mercy, Dr. Mercy is actually there, and most of her experts are also available, just in case you want someone from a different background altogether. But yes, we've had a very, very interesting conversation. The questions were beautifully said and beautifully answered. I want to thank you. While we are closing, I want to do a tour. I want to do a tour on our closing statements. I want to start with Reverend George. Let me start with you and your closing statements.
Worry, fear, social anxieties, obsessive compulsive behavior, depression, and all the rest should not be the things that characterizes you. No, you are made for more than that. Determined to pursue your unique dream and joy and enjoy the life that God has given you. There is no pain that cannot be subsided. And it all determines you, it all depends on you. You are the one to say, okay, now I know this. And as you have heard today, seek help. I, the pastor, cannot give you all the help that you might be seeking because I have not been trained as a psychologist. I have not been trained as a therapist. I have not been trained in other areas. I've been trained in a specific area. I will give you support on the area that fits me. And if I notice that you can be supported better by another therapist, I will refer you there. And that is how it should be for all of us caregivers for people who are mentally challenged. I give help where I am trained to give help, and I refer you to someone who is trained to the area where I cannot give help. So seek help and you will find it.
Thank you so much, Reverend George. Thank you so much for your contribution. Thank you also for coming on board at such short notice. Your contribution has been truly valuable. We're thinking a survivor, Dr. Message, don't call it survivor. We're thinking someone who've gone through, someone who is practicing, someone who is, but we never thought about somebody from the clergy part, and your contribution has truly just sealed, the kind of conversation that we want to put out there. So thank you so much, Dr. Vivian. I'm conscious that your time is marking, so I'm going to give you the floor next for you to to give us your final remark and your final words to our audience. And if there's any questions that I need to ask, that I need to take from the audience, and you want to take it, please do let me know.
Yeah, no, I want to start by, I'm going to let you mute.
Okay, I'm just...
Okay, awesome. I want to start by thanking you guys for having us on. It's really been a fun experience. It's been great to be able to have these conversations and, to get the conversation going and, break that barrier around mental health. But as a closing remark, I just want to tell everyone that your mental health encompasses your emotional health, your relationships, how you perform, feel accepted at your job. It has to do with your spiritual health, your relationships, your sleep habit, your eating habit, your exercise habit. So all these different aspects of life will encompass your mental health and how you feel about yourself and how it either will make you feel healthy or translate into a mental health, illness. So mental health is a state of just taking care of your well-being, right? So in preventing mental illness, in taking care of your mental health, is to ensure that each of those aspects, from your relationships, spiritual health, your sleep, your eating habits, your physical health, are taken care of, right? Because all of those will encompass your mental health. And I want you to focus on one of those things right now if you're struggling in one of those areas, so it can help improve your overall well-being and your mental health. And if you need support on that, don't be scared to reach out to someone who you trust, or just even go online, do a quick research to see what's available in your area, so you don't feel like you're alone and you can get the support that you need. But otherwise, I look forward to having these conversations again. And it was really nice, getting to be on this platform with you guys.
Thank you so much, Dr. Vivian. That was truly impactful, amazing. And please do not forget, if you have relationship issues, follow Dr. Vivian on LinkedIn, on Twitter, on Instagram. I've already followed her and I'm already benefiting from some of her series that she shares. You should as well. We can never have enough of such positive conversations. Thank you, Dr. Vivian. Now let me bring on the screen Amina. Amina, I would like you to give us your final words. While we're doing that, if we can just pause with our comments so we can so we can actually see her. That's fine. Fantastic.
Yeah, my theme today was it is okay not to be okay. So I will repeat that. Um, it is okay not to be okay. It's not shame. When you feel that you are not yourself, that you are not same, that you have a behavior change, that you are fearful, that you cry with nothing, that you are, wanted to sleep, long sleep, were always feeling exhausted, don't want to share, to talk with the friends that you used to talk, that you are not smiling, that you are used to smile. That means you are not okay. And at the same time, it's okay, you are not okay. The first step you take is seek help. Please don't suffer alone. Seek help. A big help is there, as Reverend now saying. Yeah, the religious people. If you are going to church, go to church. If you are going to mosque, go to mosque. Talk to, because every religion itself is a guidelines, and the guidelines, bring discipline from yourself, and that discipline makes you a better person. Yeah. So it is not craziness, those abuse. Oh, that's crazy. But no one is crazy. Insanity, yeah, insane. Only doctor can identify that. And these people, they are not doctors. The people who are on social media, who are bringing, a bad name, who are coming on your replay and insulting you. No, they are not doctors. They can't diagnose. They are same to you, or maybe they have a same problem with you. That is when you are ill. When you are not ill, and you have someone in your friends, in your family, who is ill, who needs help, that person, yeah, just become a listener, good listener. That's where the help starts. If she is a mom who has a young kid, just to help her, be a friend of her, ask her what can you do for her. Don't judge her. Judging is really very bad. Don't judge. You are not better than anyone. And eventually, you can get ill yourself. So it's okay to be, yeah, not okay. You have to know that. You have to repeat that over and over again until you believe. It is okay not to be okay. And when you are not to be okay, just to go and seek help, then you will be okay again. Thank you very much.
Oh my God. Every time you speak, I want to listen. Every time you speak, I just want to listen. I want to thank you so much for all that you've contributed. I want to thank you for being selfless. I want to thank you for not holding back anything, for just saying and for just saying it. But I think it is not my place to really tell you how happy I am that you were here. So I'm going to pass over to our host. But before I pass over to our host to give us a closing or the conclusion of our conversation, I want to thank Dr. Roche, who has left us because she had, of course, a patient that she had to take care of. She said I should say her final word is stop the stigma. If you feel that somebody is suffering, instead of making a mockery of them, reach out to them, offer a helping hand, love them, as Reverend Georges would say. So stop the stigma. It all starts with us. We must play our part. So, Amina, thank you. Dr. Mercy, I'm going to bring you on the screen and I want to hear from you. We are listening. You are muted now.
Amina, oh my gosh. You'll be the first one I'll talk to after this. Dr. Rushi, thank you. I know you had to go. Dr. Vivian, I know you're running late for work as well. Reverend George, it has been an incredible time with you all. Thank you so much. Short notice, less than 3 days notice, all of you rallied. I am so honored to be here talking with you guys, learning so much, gaining all these experiences. I will not take that back. I don't take that lightly. Thank you so much, all of you. I always say mental health is a journey. I always say your mind is your home. Train your mind to be your home. You have numbers that you can call at any time. You have hotline numbers for abuse, for domestic abuse, for suicide. You have all kinds of numbers that you can call. Print them out, put them in your refrigerator, put them in your phone. That way you have immediate access if something is going on. And maybe you don't want to talk to a family, you don't want to talk to somebody, call those numbers. They are 24/7 numbers. I think they should be on the screen. They are 24/7 numbers. Call. Someone will always pick up. Reach out to people. You are not alone. You are never alone. There are resources out there. Please, please use them. You cannot use them enough. Nobody will ever say, why you keep calling me with this problem? No. There are resources there for you to be used. Your mind should be your home. What is your home? Your home is a safe place where you always want to go to. After a day's work, after all the chaos outside, you always want to go home. Train your mind to be your home. Train yourself to be comfortable with yourself. Train your mind to be as peaceful as it can be. It's no need taking care of your outside self. If inside is chaos, is violent, seek help. Get that peace that you need to get. Be at peace with yourself to the point sometimes that even when you are alone, you're not lonely. You can still find that peace within you. Once inside of you is peaceful and calm, you gain confidence and know that even if you want to talk about your mental health, you're not being judged. You gain that confidence knowing that if something is wrong and you cannot fix it alone, you know how to fix it. You know who to call. You know who to go see. Train your mind to be your home. No matter what is going on outside, your inside peacefulness should be what is reflecting to your outside being. Inside should be as holy, not Holy, no, holy, WHO. Just train your mind to be that whole being that you are. find solace inside. And this doesn't happen overnight. Get help, get routine, get healthy coping strategies, healthy coping mechanisms until you find that place where you're okay. Sometimes you will not be okay. That is still okay. You can always come back home to your mind and self reflect because you are aware of what to do. You are aware of how to handle what is wrong. Thank you all. I know that the questions keep coming. We've been live for almost 2 hours now. Follow us at allmercypic.com. You can email us at mercy@allmercypic.com. And you can always call us 682-376-6776. There's always someone available to listen. There's always someone available to return your messages. There's always someone available for a free consultation. Please take advantage of these. Gone are those days when people did not get help because they didn't know what to do. Gone are those days when treatment was brutal. Gone are those days when it was just a lot of stigma. These conversations could not even happen. Today, let us take the pride in ourselves that we are knowledgeable enough not to die, or not to let a loved one die, or not to let our neighbor, our friend, go through a crisis and we act like we do not notice them. And if you're far enough, we can notice you. Get the help that you need. Help is available everywhere. Sometimes it takes just one phone call. It takes one message. If I wake up and see an email and say, I am not doing good, that will be my priority for that day. I will reach out. If you're not in my state, if you're not somewhere where I can see you, we have resources where we can always direct you to the right help. And we have resources where help can come and meet you. Because something like depression, some days your eyes are open, your body stays in bed, no matter what you do. And once your thought is straitjacket in one direction, we are able to open it up for you to see another path. If you do not get anything here today, please get the fact that you are never alone. You are never alone. If you do not get anything, look at Amina's story. And it goes back to what I was saying. It's always a misconception in mental health that once you have a mental illness, you always have that mental illness. Amina is mentally stable today. She's like me and you. She is fine. She was in a broken space. She is whole now. If you have mental health, that's not what defines you. You define yourself by how you want to define yourself. If we see Amina now, we are not looking at Amina as a mental health person. We are looking at her as Amina, the hero, the voice, the person who has changed so many lives, the person who has transformed so many things in her community, the person who has put life and voice into so many people. But that is someone who had mental illness. She shared her story. She's not afraid to share that. She shared her story. It is in the past. It is not who she is now. Let us forget that, oh, if I tell someone I have depression, they'll always look at me like I have depression. We are the same people. You have malaria. You have typhoid. You have diabetes. You have high blood pressure. You have depression. You have anxiety. It's the same thing. What is your health without your mental health? Mental health will affect your emotions, your feelings, your thought process to the point that it starts affecting your behavior. Don't let it go that far. Let it not affect your behavior. Let it not affect your functionality. Seek help. You are not being judged. You are not being judged. Don't let it become a severe disorder. It's never too late. Seek help. We are here all the time. You are not alone. And that is not what defines you. When we diagnose you with depression, we have not said your name is depression. When we diagnose you with bipolar, we have not said your name is bipolar. You are who you are. You are who you want to be. Mental health is a journey. I hope and believe that we are all going to take the wheels and ride together. Thank you so much, all of you who were able to join us. Thank you so much.
Wonderful. Wonderful, wonderful, wonderful. We're just 30 seconds away from 2 hours. 2 hours that people keep joining and people don't want to leave. Dr. Mercy, thank you. Amina, thank you. Reverend Georges, thank you. Steffi Verna, thank you. Team FabAfriq, thank you. Dr. Roche, thank you. Dr. Vivian, thank you. Etuga Mabel, thank you. Thank you, Remy Candle. Thank you, everybody who've been promoting this webinar. We only had 1 week to plan and see where we've come. So I'm not going to take any more time because I want us to wrap up in 3 seconds. But thank you. My name is Adeline Sede Kamga, founder, CEO of FabAfriq Media Group. It has been an absolutely joy to host this webinar. I hope we're going to do this over and over again. I hope I'll be seeing you all soon. So thank you, and let's stay together. If you see it, spot it, and say it. Bye for now, and see you all. Bye. Put my screen. Bye, everybody. Thank you very much. Thank you so much. Now gone.